present moment is the only time an orgasm truly happens. So
can you be 95 and still have sex?
Many people will say sex gets better with age. Humans weren't born hating themselves. Humans weren't born comparing themselves to like, do I have the latest fashion? Do I have the best haircut? We've created chaos. Pain with sex is very common, very undertreated. The studies show that women don't even tell their partners that they're experiencing pain with sex.
What I found is a lot of people, women that I know, after they have kids, like quite a bit after, they'll start having a lot of pelvic floor issues.
The pelvis will never be exactly like a pelvis that hasn't had a kid through it. A lot of women aren't told that, but what they can do to help.
What is the sort of physical activity that you do and that you would recommend for women heading into their midlife era?
Women with the most muscle mass live the longest. So there's this, I think the big thing to know is like libido is very complex. So for people to oversimplify it and be like, it's just my hormones or it's just stress, completely complicated because it's everything.
What do you think that people, particularly women, don't know so much about women's health that the spotlight hasn't been placed on that they should know? Kelly Casperson, thank you for coming on to A Life of Greatness. You are a urologist. Can you talk to us a little bit about that? Because when I was kind of researching what a urologist is, well, knowing actually I have two friends that are urologists, but they're male urologists. And I thought that urology was, male reproductive health and fertility. But that is not what you do. Explain a bit about your journey to us.
Yeah. So urologists are surgeons. We're surgical subspecialists of the genital urinary tract. So it's actually quite broad, right? It can be kidney, it can be bladder, it can be prostate, it can be male genitalia. Less common female genitalia, but more and more of us are caring about gender equality and taking care of all bodies. In America, 10% of urologists are female now, so 1 in 10. There's about 1,000 of us in America. And women tend to want to see women. So I did a lot of bladder leakage, prolapse, a lot of that work. But, urology is very diverse, right? You can do male infertility, you can do prostate cancer, you can be a kidney stone expert. So even, a lot of people will say, oh, okay, well, can I just go see a urologist to get what I'm talking about on podcasts? And I'm like, no, not all urologists will know this because I'm kind of the, specialty trained within this broad field of urology.
But wouldn't a gynecologist see that? Like if I had those issues, I would go to a gynecologist.
Sexual function issues or
anything
hormones?
To do, yeah, absolutely.
No, that's the stereotype, right? The stereotype is that this one type of doctor should take care of 50% of the population. And first of all, the numbers don't make sense. It's a gynecologist in America. There's about 40,000 gynecologists and there's about 40 million women over the age of 40. And so it's this very common stereotype that, just go to your gynecologist. And it's like, they're busy taking care of pregnancies, abnormal bleeding, uterine cancer, right? They're busy taking care of lots of other things. Many of them did not get trained in hormones. Many of them did not get trained in sexual health. So my talk is like the GP, the general practice should be comfortable doing all of this because this is 50% of the population.
Yeah, that's so interesting. So my dad's actually an obstetrician gynecologist, one of the first team in the world to ever do the IVF. And so I know quite a lot about this area because I grew up with it.
Yeah, cool.
Yeah, it's an interesting thing because who looks after what these days, is hard to work out for a lot of people. And I know GPs don't know this stuff. They don't. Yep. They see so many cases, it's so varied that I find that a lot of the time, the different ones I've been to are good to refer you on to people, but they don't know the information themselves. And the urologists that I know in Australia are looking after men's health. So, yeah, it seems to... But I do know gynecologists that do look after hormones and things like that too. So I suppose it varies from country to country.
Yeah. I mean, my biggest, again, argument is women are 50% of the population. This is too big to just put on one group of doctors. And, the science changes, the recommendations change, and what we learned in medical school might be wrong after 20 years, right? And so really to get somebody who's willing to listen to new guidelines, who's willing to listen to new things, and it doesn't really matter what they were trained in, are they able to hear you, listen to you, and help you?
Yes. I wonder in your practice, because you were telling me you still practice, you don't do surgery, what have you found is the common thing that women come in with?
That they've seen many doctors and the doctors aren't listening. And it's usually untreated menopause and a lot of untreated perimenopause. So perimenopause being the years leading up to menopause, because there's a lot of myths, like you can't get treatment because you're still having periods, or you have to be a certain age, or kind of all these myths around it. And so they're profoundly suffering. And many people in the data shows that sometimes perimenopause is more symptomatic than menopause because of the change in fluctuation of the hormones. And then the other thing they come and see me with is sexual health issues, because we didn't get a good sexual education. We don't know how women orgasm. We think it's how Hollywood tells us women have pleasure, right? Which is not really how the bodies actually work. So a lot of sex education stuff and learning how to communicate and kind of just learning the basics to optimize your sex life.
How old typically are the women that come in to see you?
Oh, I see it. The youngest is probably late 30s, because perimenopause really does start kicking in for some people in their 30s. And then I see 70-year-olds who say, "Is it too late for me? What can I do? Or I've been suffering so long. What can I do now? Because we actually have people who can help me now." So yeah, 30s through 70s usually, but certainly women, especially with vaginal estrogen and recurrent urinary tract infections, very common to start a woman in her 80s on vaginal estrogen for those issues.
From a sexual health perspective, what are the common questions that you get asked?
Low desire is the number one reason that women will go to their doctor for sexual health issues. Changes in orgasm, decreased sensation that kind of can come along with changing hormones. Pain with sex is very common, very undertreated. The studies show that women don't even tell their partners that they're experiencing pain with sex. And so pain's a common one.
Do you think that's all hormone related, or some people might just have that as well?
Yeah, it certainly can be hormone related, but it's not always hormone related. Tight muscles in the pelvis, a tight hip, an injured hip, an injured back, right? So if there's a pinched nerve, if there's a skin condition, so there's lots of different reasons for pain with sex.
And when it comes to orgasms, what are people talking to you about?
Usually diminished orgasm is what's common with when hormone changes. Like, they'll say it's kind of difficult to kind of get over the mountain, right? Like I keep climbing the mountain, but I just can't get over the mountain is a common one in midlife. People don't know that the genitals need hormones to be functional. And so the labia minora can go away. That's a sexual structure that protects the vagina. The clitoris, the skin that goes over the clitoris, called the clitoral hood, can get attached to the clitoris and become painful when pulled, or kind of diminished sensation because it's covering the clitoral head. So those things can happen. I would say it's very common that doctors aren't well trained in female genital exams. So I'll see people and do an exam and they'll say, "Oh, my other doctor said it was normal." And I'm like, "Well, you're having pain and it looks like this. I would not call this normal."
And so what sort of treatment do you recommend for people who are coming in with that stuff?
Well, again, it depends upon what it is. Education always for number one. Let's look at your body parts. Let's get the right words for them so we can all be on the same page when we're talking about things. Physical therapy, a good pelvic floor physical therapist is incredibly important, because they'll work on hips and pelvic floor muscles. And do we have a tight psoas muscle? And, is your sacrum off balance? So all the kind of biomechanics of the pelvis that can cause pain with intimacy. And then a good sex therapist, right? So the biggest sex organ is our brain. And if we've set up an avoidance pattern because things have hurt, even if we fix where the pain is, if our brain is avoiding things, because we don't want to hit our thumb with a hammer, right? We don't advance towards painful things. And so oftentimes it does take a sex therapist or a pain therapist to help say, what can we do to make the body feel safe, to find and discover things that are pleasurable, right? So it's not just hormones. I call it the three-legged stool with pain with sex. Is like we need hormones, we need a good sex therapist to work on the brain component, and a good pelvic therapist to work on the muscles, the bones, the nerves.
It's so interesting when you talk about the pelvis and, going to someone that can look after that kind of stuff as far as pelvic floor and all that. Because what I found is a lot of people, women that I know, after they have kids, like quite a bit after, they'll start having a lot of pelvic floor issues. So it doesn't, for some people, I suppose after you have kids, it can happen straight away. But some, it can end in a kind of a prolapse. I know a few women that's happened to. What do you see when it comes to that kind of area with women that they can do to prevent that in the long run?
Yeah. So first of all, prolapse is incredibly common.
Yeah.
It's not all surgical, and it's for the most part, it's not harmful. And most prolapse, especially if you examine it, you might have a little bit of laxity. I say anytime you've put a kid through the pelvis, whether it came out of your vagina or cesarean section, your pelvis is different than before it had a kid. Like that's just always the rule. It will never be the same again. You've put a kid through there. And a lot of women aren't told that. Right? How many women say, nobody told me that was going to happen? It's this lack of kind of body education. The pelvis will never be exactly like a pelvis that hasn't had a kid through it. Not to scare people, just to say that's fact. Just women aren't told that. But what they can do to help decrease the risk of both bladder leakage and prolapse is fix any sort of chronic cough, chronic constipation, any sort of, big stress or strain on the pelvis that's repetitive. Maintain a normal weight. Just extra weight on the pelvis can push on things. As we age, our hormones go down. We don't have great data on vaginal estrogen preventing prolapse. Theoretically, it could because it helps collagen and helps maintain structures. But a lot of prolapse really is, the wear and tear that comes on the ligaments and the support structures from time, babies, chronic cough, constipation. So vaginal estrogen can't reverse all of that. We lose muscle strength as we age, partly because we're not maintaining our muscle. And second is we decrease our hormones. So likely decreased muscle leads to more prolapse. Again, muscle is another support structure, and that is declining. So the bladder can become affected. And just to go back quick for people who might not know what prolapse is, it's the vagina turning inside out, kind of like a tube sock turning inside out, and you can feel a bulge coming out of your vagina. A lot of people will call it bladder prolapse. The problem with that is people think the bladder is the reason for it, or it's the bladder's fault. That's not, the bladder's not trying to leave your body. It's just on the other side of that bulging wall is the bladder, which is why people call that bladder prolapse. But that doesn't mean it's the bladder's fault, and it doesn't mean the bladder tried to do this. It's usually the support structures of the vagina have been broken, loosened, elongated. And so with time and gravity, we're upright mammals, right? That the vagina can sag down or protrude out like you're taking a tube sock and turning it inside out.
When you're in hospital, I know this happened with me, and it would probably happen a lot in Australia, I'm assuming all over the world, and the physio, as part of you being in hospital, visits you and they say, you got to do these exercises, and they show you some exercises to do to help strengthen what you're talking about. Like, does that make a big difference? Should everyone be doing those exercises, continue to do those exercises when they leave hospital? What are your thoughts on that?
Yeah, well, I would say you're actually pretty lucky because in America, I don't think anybody gets told anything. We're like, here's a baby, congratulations. Get back to doing everything you can. And people aren't taught, like, to recover from having a child is a good year, at least a good 6 months. And at least in America, the stereotype is by your 6-week checkup, like, you're good to go. And a lot of women are not good to go. And they feel very broken that their body isn't good to go. Like there's something wrong with them. Instead of realizing like your body physiologically just created life, which is a huge stress, and it does take a long time to heal. So I think the pelvic floor physical therapist would agree with you of like, yes, you should probably just always do those exercises just like, if you want a nice bicep, you got to work your bicep. If you want a nice pelvic floor, remember to remember to use it. The caveat would be if you're experiencing any sort of pain, sometimes tightening exercises or strengthening exercises are the wrong thing to do because that can make pain worse. So there's also lengthening exercises, relaxing exercises, and that for people with pain, because the pelvic floor does need to be strong, but also does need to be able to relax. And if it's, I would say too strong, but if it's too much of one thing than the other thing, you're going to get a lot of pain.
And a lot of
or you
women,
can get pain.
yes, a lot of women will talk about, jumping. They might be on a trampoline or they're just doing exercises like skipping or something that involves jumping, and they feel that they have bladder leakage. What is the best thing to do in that sort of situation?
Yeah, pelvic floor physical therapy.
Yeah.
Because bladder leakage is not normal. It's common, but it's not normal. And the first line therapy before you get into surgeries and procedures and things like that is pelvic floor physical therapy of like, where are you strong? Where are you weak? Where can we, optimize this and ideally not need a surgery for it. But sometimes our bodies change enough where physical therapy doesn't help and there are surgical options.
But there is the possibility for it to be fixed if that happens.
Oh, yeah.
Yeah.
Yeah, pelvic floor physical therapy is quite successful. It's not 100% successful, but it's quite successful.
Yeah, that's really good to know, because I feel like a lot of women might think that this is just what it's like now. I've had kids, the area is weak. I jump on the trampoline and, I have bladder leakage or whatever it is. I'm not going to do that anymore. I'm going to avoid doing anything that, makes me jump. So it's great to know that this can be reversed without surgery in a lot of cases.
Yeah, I mean, we know a big predictor of frailty and aging is not doing enough physical activity, right? And then you have to think 1 in 3 women, 1 in 5 women to 1 in 3 women, depending upon what stat you're looking at, does leak urine with physical activity. So now they're limiting their physical activity to not leak, not knowing there's something they can do. And now you're missing the benefits of cardiovascular fitness, of muscle strengthening, of mobility, right? Because of the bladder. So it's not just like that you don't get to enjoy the trampoline at the kid's birthday party, but if you're limiting your physical activity, that can have profound repercussions for aging well and for aging strong.
Talk to us about physical activity now. What is the sort of physical activity that you do and that you would recommend for women sort of, heading into their midlife era?
Yeah. I mean, right now, I grew up in the 90s, right? And we really have to work on, we were taught be as small as possible. Be as small as possible because that's what's beautiful. And that often means a lot of cardio. And cardio is good for strengthening your heart, but we're missing, being small as possible means having as little muscle as possible also, because muscle weighs something. And where we are now with midlife, and I have a whole chapter on this in my new book, is muscle is a metabolic organ. It actually helps, it's a glucose sink. It actually releases brain-derived neurotrophic factor, like the brain gets better when you lift weights and exercise in general. So it's really, kind of turning the tide on, we don't want to be as skinny as possible anymore. We want to be as strong as possible. Women with the most muscle mass live the longest. They actually did a correlation that women with the biggest hand grip strength have less bladder leakage. And women who have the largest muscle in their legs have less dementia. So there's many different domains where muscle really is a strong predictor of loss of, or not being frail in older life.
It's really interesting. I was just talking to someone about this on the weekend. The idea of like grip strength and knowing how long that you will live for. I know Andy Galpin, who we had on, talked a lot about that. But I also have heard, about when you mentioned it, it made me think of it early on, how if you might have bladder leakage, you stop doing certain exercise, or you just stop doing exercise because you're worried that you're going to leak. And all these things can end up causing dementia, not so much because you're not doing that one thing. It's because you start isolating yourself,
Yes.
and you start not going out. And then suddenly your eyesight gets bad because you're not really going outside anymore, and you're not experiencing, the different colors of the world, and you're staying indoors more. You're not seeing people, you're not speaking to people. And it's this one little thing because you're worried about it or you think you can't do it, you just stop doing it, and then your whole life can tumble after that. And I had never thought about that before until speaking to people like yourself and Andy and a few others, where I was like, wow, that just makes so much sense that, we will try and, I suppose, mollycoddle ourselves a little bit to protect ourselves, and we have only good intentions, but that can end up being actually the real downfall of our health, and why sometimes pushing ourselves a bit and doing it with informed information can be life-changing.
Yeah. Yeah, absolutely. I mean, it's the same interesting thing with hearing loss, right? Like, so hearing loss is a huge predictor of dementia. And you're like, okay, is it just that the brain's not getting that cognitive input? And so the brain's changing? Probably. And you become more isolated. You stop participating in conversations, right? And we know the more isolated you are, the higher, you have a risk of depression. Same with not leaving the house because of risk of bladder leakage. It's like when you aren't surrounded with community and you're not engaging, we have a higher risk of depression. That's associated with dementia. So it's like all fascinatingly related. And you're right. Like, I was just talking to a gentleman and he's like, we really took it easy on our aunt. Like, oh, she's old. Don't let her, do this for her, do this for her. Don't let her do that, blah, blah. And he's like, I wonder if we actually made things worse because she just did less and less and less as we kind of enabled everything around her. And now she has dementia. And I'm not saying like we have to make old people do crazy things, but it's like the body changes and adapts to stimulus. And have we made life too easy where the body's actually declining because of it? That is a big conversation people are having.
That is exactly what I was talking about and been thinking about, because the hearing loss thing I was thinking about because I saw it on the weekend, Peter Attia talking about it. And then I looked it up. And if you get a hearing aid early, then the chances of dementia are like a lot less, right? Because then you're still going out, the brain is getting what it needs. But as you said, it's when you pull back. I can imagine it would be the same with eyesight. If your eyes are getting really bad, you probably have a higher chance of dementia too, because you're going to be sitting in your house not doing anything because you're too scared, which is, we get it. That's understandable as well. But it then can lead to worse and worse things. And, the whole conversation then starts about how sometimes pushing ourselves that little bit more can end up, really bearing the results. And I was thinking about my grandma. I mean, she's 95 and, when you're 95, you can do whatever you want, really.
Yeah, I agree. When you're 95, you can do whatever you want.
And to live
but the vital ones are exercising.
Exactly. And in the last year or so, she's had, some people around her pass away and things that have obviously shaken her. But she is very much less active. Like, she's barely active. But her mind is still there. But you see that, I mean, she's 95. But the body, is a lot worse than what it was. But granted, I am still really aware that she's very old.
Yeah.
But also that lack of movement and she used to walk all the way around the age home. She would a couple of times with her walker and this and that. And she just doesn't do that anymore. And the less she does it, the less she's able to do it. But I think you don't have to be 95 for that to happen. You can be 60 or 70 and you can gradually decline because you're not being active. You're not pushing yourself.
I see that a lot with back pain or people who are sore, right? I don't want to work out because I have back pain. And it's like back pain gets worse when you don't move your body. Yeah. So it's very counterintuitive for people. Like, and then traditionally it's like, oh, don't do it if it hurts. And I'm not saying push through extreme pain. I'm not saying that. But what I'm saying is people don't often know that the more you move your body, actually the less pain you will experience. The body loves movement. And I think the other thing for middle life is flexibility, mobility, putting your body through just range of motion stretches, getting it. I love doing a little bit of yoga and kind of getting all the cracks out at this point, and it's like, I know just by doing that, like I'm stimulating the body and I'm putting it through its range of motion, and it will get more stiff with disuse.
What I love about your work, Kelly, is you talk a lot about the mind, and we touched on that earlier. why is the mind such a critical component to all of this when we might think, oh, it's just our physical health? I mean, I know that the mind plays a big part in physical health as well, but I'd love you to talk about that.
Yeah, I mean, I think we're in the ice ages when it comes to understanding the power of the mind in influencing our health. We know chronic stress influences our health, right? And so in getting older, the way we think influences our health. And there's some amazing research, and it's like thinking of the future, a forward-thinking individual, they actually have better health. They actually live longer than the people who say, "Oh, it was so good back then." They're always very past focused. Like, that's incredible, right? Like, you thinking of the future keeps the body and mind going versus thinking about the past. And that's something not many people talk about, but it's fascinating research of like, and I have that in my next book of like, how do you age well? Is like, have things that you look forward to, have planned things, right? Keep the body and the mind focused on moving forward. And I've had the pleasure of taking care of patients for over 20 years, and anybody over the age of 80 and marriages of being married more than 50 years. Those two groups of people, I always ask, what's the secret? What's your secret? Right? Because it's like, I see 20 people a day. Might as well figure out how the winners are winning. Yeah. And they constantly say, especially the people over 90, what's the secret? Keep moving. Keep moving. And with the marriage, the 50-year marriage, they say, don't take everything so seriously. Let some things roll off your back. And so it's like those two group of people have a lot to teach us on like, how do we do this well?
It's interesting. I was listening to, I love his work, but I was listening to a lot of Eckhart Tolle recently.
Yeah.
And there was one line that he said recently, because he is like, obviously, The Power Is Now was a huge book a long time ago. So he is like the mindfulness guru. But he says, don't dwell, you have to keep your mind from really dwelling in the past. And he even kind of spoke about grief. And he said, it's fine to grieve, but don't stay there, because you'll stay there forever if you do. You must move the mind, to your point, to the now, to being grateful, to things that you're looking forward to in the future, but don't keep the mind in the past. And I think about that a lot when I go there, and it's natural. You can go to a place in your mind and get so annoyed. This should have happened. Why didn't they do this? Why didn't they do that? You know what? As soon as you do that, you can feel the energy start to change in you. You feel yourself getting angry. You feel those emotions. And when I do that, I'm so mindful of it, so conscious that I think, why am I going back here? Why am I going back here? It's not serving me. I've had this thought 100 times before. It's like the mind tries to figure it out. It's not going to figure it out, hey? You just got to move it back. Move it back. And I love what you say about planning things to look forward to. I just got back last night. We're away for 5 days. Had been school holidays here. And we just had such a good time walking in nature, things that I don't really get to do living in the city so much here. Those 5 days is a short period of time. I can't tell you what a difference that made. Just walking, talking, it's just so good to have something to look forward to, so good for the soul to kind of get out of your normal everyday. And these aren't big things that we need to make change in our life, but they really change our emotions, and our emotions can change our health.
Yeah, 100%. And I think that education, we're at our infancy of people understanding you have the power to change your thoughts. You also have the power to not think what you're thinking, right? And how much power we give our thoughts. People are like, the heart beats, the hips move, the lungs breathe, the brain thinks. Like, this is what it does. It has its thoughts. And we get so attached to what the brain does, and to realize you don't have to. You can say, that's a thought. My brain's choosing to think right now, and I'm going to let it go. Right. And in doing that, into working on it, you realize you can change a lot of things, or at least change the grip that, some thoughts, they're in there. They're well-worn roads, whether they came there from childhood or society's put that thought there. You can say, yeah, I know. I have that thought a lot because I'm really good at thinking it, but I don't have to emotionally respond to it. And I can choose to be like, not today, brain. Like, let's not do that today. Let's go think about this. Like, we're not taught the incredible power we have over our thoughts. And I think that's what, Eckhart Tolle is so amazing at. I did a week-long retreat with Eckhart Tolle in Maui.
Wow. How
It
was
was very
it?
cool. Oh, amazing. First of all, you're in Hawaii, which is incredible. And then to listen to him basically for 5 days. And right after that retreat, like before I left Hawaii, I unfollowed some people on Instagram that they're just very negative people, and negativity is very attractive, right? Like people like to look at it. What do you think? That's why news is the way it is. People like the negativity. And I unfollowed a couple, and best thing I did. It's like we can choose to not put that negativity in our brain. And so just this week, somebody's like, do you follow blah, blah, blah? And I'm like, no, I went to an Eckhart Tolle retreat a couple of years ago, followed him the day after, unfollowed him the day after. So it's
so
like we have
funny.
the power to choose.
It's so true, Kelly. And so this weekend, all I've been listening to is my dear favourite teacher, Wayne Dyer, who, I wish was still alive.
Yep.
And he's got this book, which is basically his lectures, which is like a spiritual solution for everything. And he says that exact same thing, which I know, what you feed yourself becomes your reality, right? And so if you're feeding yourself negativity the whole time, you live in this world of chaos. You live in this world where you think that something's going to happen. Crime is so bad, and it's just this state of flux. And as you know, as a doctor, if we're in fight or flight the whole time, what is that doing to the body? It brings dis-ease, which is disease. And so we need to be so careful of what we put into ourselves. And I was thinking a lot about social media this weekend too, and made the conscious effort to not look at other people's stuff on social media. Like I did what I needed to do on my own page, and I just left it at that. And you don't realize what a difference that makes when you're not feeding yourself just constant highlight reels from other people that isn't even the truth of their life. But then we create these stories, we start feeling lack, and then our whole mood changes.
Yep. Oh, yeah. I mean, I think that, tying back into sex lives, women's sex life is like, if you're in this activated sympathetic nervous system state, which we are for most of our day, right? Like what do the kids need to do? What does our job need to do? Do we have food in the refrigerator, right? Like we're constantly on this vigilant sympathetic nervous system. And then we either like don't think we can have a good sex life, or we think we're entitled to a great sex life when we in fact don't realize how much negativity and stress we're feeding our body every day, and realizing like great sex is actually a relaxed, parasympathetic, quiet, present moment brain, right? And understanding that physiology and how do we change from go, 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 career driven, get the to-do list done to I feel safe, I feel relaxed, I feel accepting of other person's touch, right? Like it really is a different nervous system switch. And we're fed by Hollywood and bad sex ed that you should just be able to go at the drop of a hat and this, flip of a switch of like, you have to change your physiology to truly have enjoyable present moment sex. And that's why they say sex is so mindful and spiritual, is because you literally have to quiet the mind. You can't be planning. And what an orgasm is, the frontal lobe of the brain is off. People describe it as like you're a dumb 2-year-old when you're orgasming. It's like you don't have any executive function. And you do, there's books on it of like mindfulness for better sex. Is like you can literally learn how to quiet the mind to be in the present moment, which is the present moment is the only time an orgasm truly happens.
Really? That's so interesting.
So it's all related.
Yeah. And also it just made me think for males and females, if you're on social media and looking at like models and their unbelievable bodies, no wonder you might go into the bedroom and feel insecure about the way you look, which is just a normal person, because you feel like you don't look good because you're looking at these like models the whole day, which isn't reality of what people look like. And that, I mean, you must see that too, where women are just, and men are just afraid about their bodies because they're scared that they don't look good.
Yeah, I mean, our culture exists on telling people they don't, match up or meet up or are as good as, right? Like we market people that all the time, from beauty products to, cars are marketed with sex. Like you're going to be attractive if you have this car, right? It's all comparison. It's all trying to match up. And you have to think like not very long ago, we didn't have any of this. Not very long ago, we didn't even have mirrors, right? Not very long ago, it's quite possible there were no body image issues. Because there was nobody creating an economy based on making you feel crappy about yourself. You didn't even know what you look like. We didn't even have mirrors, right? And and to realize like we're in a situation that we actually created. It's not real or reality. Humans weren't born hating themselves. Humans weren't born comparing themselves to like, do I have the latest fashion? Do I have the best haircut? Do I have the thinnest nose? Whatever it might be. Of like, we've created chaos and really gone away from self-love, self-acceptance, existing in a human body and what that actually means.
Talking about sexual health and intercourse, why is foreplay such an important part of sex?
Yeah, well, in order to desire sex, you must have sex worth desiring. Right. And if you look at heterosexual sex, the man is called the orgasm gap. The man has an orgasm much more than the female does. And what we know is that penis and vagina sex or intercourse, that is a great way for a man to have an orgasm. It is not a great way for a woman to have an orgasm. The clitoris is on the outside and the clitoris is wrapped around the vagina on the inside. So the vulva is on the outside, clitoris is wrapped around the vagina. So putting something in the vagina, especially putting something in an unaroused vagina, does not cause pleasure for the female. And if she's experiencing pleasure 30% less than the man is experiencing pleasure, she's having a different experience of sex. Right? And so we say, well, women don't like sex as much as men. That's not technically true. They don't like the sex they're having as much as men like the sex they're having. So they did this fascinating study. They asked they went on a college campus. They asked all the men, would you like to have a one-night stand tonight? Every single man said yes. They asked the women, would you like to have a one-night stand tonight? Every single woman said no. And they said, well, women don't like sex as much as men. Well, that's technically true because the women said no to it. But if you think about what a one-night stand is, there's no connection. The woman only orgasms 7% of the time. It's all about the male orgasm. That's a worse experience for her. Of course she would say no. So another researcher said, let's switch this around. Let's ask the women, if you could have sex today, one night stand, you feel loved, you feel supported, you are guaranteed to have an amazing orgasm, and you feel safe. Would you like to have that sex tonight? Women? Yes, I would like to have that sex tonight. So it's not that women desire sex less. The sex they're having is less desirable. So to go back to your question of why is foreplay important, because if you want to have sex with somebody, you might want to make sure they're having as great of a time as you are. That is good information, especially for the men. Right?
I agree. I just think, I'm not a man, obviously, but like, it's so not one-sided. And if a man thinks that a woman orgasms in the same way they do, get with the time.
Well, they think that. And again, I'm stereotyping a large population, and I never want to piss anybody off. But I always tell women, men did not get a secret class on how to deal with other people's genitals that aren't your own.
Yeah.
Right? Like they do think that's pleasurable because that's what Hollywood says and that's what porn says. Like they don't know any better. And so it is, not to put the burden on the woman because also the man should know this, but like it is our job to be like, this is how I like to orgasm. We must have that knowledge ourselves and we must be able to communicate it. We must not give away our power to other people and assume they know or assume they know best. We're assuming a lot in sex because we don't know how to communicate about it.
For any women that might be listening that may never have orgasmed or find it very hard to orgasm, what do you think are the best ways for a woman to be able to get that pleasure?
Yeah. I would first tell her, you're not alone. You're not broken. In our society, women are socialized that their bodies are dirty, that it's bad to touch your body. I mean, little boys touch their penises because they have to do it to learn how to pee, right? So boys are used to touching their genitals at an earlier age, much more than women are. So there's just that. Realize you are socialized. This is not an inherent brokenness. So just to help women feel better. There's some great resources. An online resource is omgyes.com. Great resource, and it's more video to visualize. What does touch look like? And these are wonderful. I've vetted them. Doctors have vetted them. This is not like a pornographic. This is more of like a sex ed, right? So OMG Yes is a great resource. It's an older book, but it's a great book. It's called Sex for One by Betty Dodson. Really to say, how do you orgasm? How do female bodies orgasm? And then realize that the best way for a woman to orgasm in a partnered relationship is for her to understand how her body works by herself. It's very hard to communicate that if you don't know the own skills yourself. So that self-touch is healthy. That orgasm actually, it reduces stress. It really, releases oxytocin. People have colds for less amounts of time. There's some data that sexually active people live longer. So I never want to tell somebody that orgasm and pleasure is good, therefore you must do it. That's not what I mean. What I mean is your body was designed for pleasure. This is safe. This should be allowed. We've been socialized the opposite of the truth. And then vibrators, I joke, I'm like, I have 3 vibrators for my mouth. I have an electric toothbrush, an electric flosser, and a water pick, right? Why do I have so much technology for my mouth? Because it's designed to do a better job than my hand and a tree branch, right? And so don't fear the technology. Vibrators these days are incredibly well created for female orgasm. Don't be afraid of them. High quality is nice. The quality of them. There's a great Australian product. Hold on, off the top of my head, great Australian vibrator company. Oh, help me out.
I don't know.
I know. I'm like, I'll find it for you and we'll put it in your show notes.
Yes,
but I'm like, I don't have.
me.
But there's a great Australian company that does
Awesome.
vibrators, and people should check it out and support Australia.
And for anyone who's older out there thinking I'm too old, I've gotten to the stage where I'm too old, sex is over. Is that true? Can you be 95 and still have sex if you have another partner that's old enough and still alive and wanting to have sex too?
Well, I tell a funny story about that. So I had a couple come in there in their mid 70s, and you need help. You might need hormones, you might need lube, you might need some Viagra. We might need help. But this couple in their mid 70s, they're having sex 3 times a week. They freaking love it. It's more sex than they've ever had, and they've been together for 50 years. They're just having a riot with this, right? That same day, a couple comes in, they're in their mid to late 40s, and the man says, "Doc, if you just tell us that we're too old for this now, and this is how it is, we'll accept it." And I'm like, you should have met my 75-year-olds that came in 2 hours earlier, right? And it's this stereotype. Again, society tells us that only certain people are allowed to have sex. Able-bodied, attractive, young, possibly married, right? Not the single people. So society tells us who's, air quote, allowed to have sex. And that includes not being old. But it's sex is actually, many people will say sex gets better with age. Why is that? We learn to communicate. We learn to try things new. We prioritize pleasure over performance, right? We prioritize communication. We prioritize connection. So it's not, the stereotype is sex goes downhill, but many people will say sex didn't get good until I was 60. Sex didn't get good until after menopause because I stopped trying to perform or be there for somebody else. I cared more about connection, communication, and my own pleasure.
And do women talk to you about also how, might not have to do with physical health, but they might just mentally be turned off their partner and that puts them off wanting to have sex? Do you find that?
Yeah, I mean, that's what the joke is, that foreplay starts at 8 in the morning. Of there has to be a connection there, a non-sexual touch or a connection, and keep that going so that sex isn't the only time where you're supposed to be connected to somebody. And going back to the thoughts we think about our partner influence our desire to have sex with that partner. And if we're looking at them and we're like, they are the best father ever. They're so good at their job. I love them in those jeans. They're so sexy. Those thoughts are going to give you very different outcome than he never does anything right. He's really let himself go. Like, the thoughts we have about our partner matter, and we're in complete control of those. So do an audit. Check that out. It's just the joke is nobody's ever so good at sex that they can't get better.
Yes, that's so true. Talking about hormones now, because that's obviously a big area that you are in. What do you see in fluctuation of hormones to do with desire that women may have? And also, I'm sure it's not always like that either. So I just want to say that too, that women don't think, oh my God, I'm in perimenopause or menopause and this is going to happen to me, because that's not true.
Yeah, I mean, I think the big thing to know is libido is very complex, biopsychosocial, right? How we've been socialized, how our relationship is, our thoughts, how stressed we are, and our hormones. So for people to oversimplify it and be like, it's just my hormones, or it's just stress, or it's completely complicated because it's everything, which is good news, because if you really are missing one piece, it doesn't mean all is lost. But, the stereotype is that testosterone is the desire hormone, and we'd have data that testosterone works well for desire. But there are many women we give estrogen back and they're like, oh, everything's good now, right? So estrogen's also important for desire. And again, desire comes in many types, spontaneous and responsive. But really, hormones play a role in genital blood flow, in arousal, in lubrication, in the brain being interested, that to quote, turned on. So libido is a mood, right? And hormones profoundly affect mood. So it all plays a role. Oh, going back, Australian vibrator company, Elixir Play. Elixir Play.
The best.
They're amazing, really high quality things. The founder is a female who lives in right outside of Sydney. So I would direct people to it. Get an Australian vibrator.
Thank you so much, Kelly. I wonder, you're obviously, a specialist doctor. 1 in 2 people these days will get cancer. And I mean, that is just a huge rate and not a good one. For women who have cancer, had cancer, HRTs, their oncologists have told them they cannot take HRT. What do you suggest for people in that situation?
Yeah. Well, whenever anybody says I can't take hormones, I always question it, because hormones is a very large tent.
Yeah.
Right. There's many different types of hormones. And so whenever somebody says I can never take any hormones, I'm usually like, that's not true. There's always something, right? Usually. So whether that's progesterone, whether that's testosterone. So when people say you can't take hormones, they tend to mean estrogen, but we have many more hormones than just estrogen. And there's a big difference between systemic hormones and vaginal hormones. And I would say it's pretty universal at this point that even the hormone-sensitive cancers, which doesn't mean hormones cause them, it just means they have receptors for them, that they can take vaginal estrogen products. Again, vaginal estrogen products are dosed locally. They don't go into the bloodstream. The brain doesn't see them. The breasts don't see them. And we have studies on over 55,000 breast cancer survivors on the safety of vaginal estrogen. And we know these women are suffering recurrent UTIs, lack of a sex life because of pain or dryness, overactive bladder. Like, they're suffering. And our miseducation or lack of education is keeping them from a safe, effective medication. So I always question when people say, I can't take hormones, because I'm like, it's a big tent. We can at least have a conversation about the local ones.
Yes. Because it must be so tricky. Because something that is information that is not correct can really be detrimental, right?
Isn't that the
case
truth?
Of someone that has had, cancer that is driven by hormones, right? So, it's such a fine line. to be able to give people this information? And would you say, like a friend of mine had breast cancer. She's young, and I think it didn't spread anywhere. And she was telling me, she was asking me, what different supplements do you take? And I actually don't take that many, but one that I do take is collagen. And so she was very interested in it. And her oncologist actually said to her, you cannot take collagen because that is going to expand the cells or create cells that we do not want you to have. And I thought, my God, I've never heard that before. But that came from her oncologist for whatever type of breast cancer she had. So I'm just, as you would know, you kind of want to say to people, just talk to your oncologist about what's good for you. What we know about cancer is it's a blanket term for so many different variations of cancer, right?
Kind of like the term hormone, right?
Exactly.
It's a large tent.
Like there are that many different cancers. Even if you have breast cancer, there's a gazillion different types of breast cancers
That's right.
out there,
That's
right?
exactly right. And what your sister can and cannot have because of her breast cancer is very different likely than what you can or cannot have because of your breast cancer. Like the worst thing we did was to lump all this together. And,
yes.
So even oncologists will say this is like the fact that we call all of these different things breast cancer is like they're profoundly individual situations.
Yeah. And it's interesting, someone I know this friend of mine that had cancer, they said to her, just be careful about listening to other people's stories of other people that have cancer. And this actually goes, I was listening to Wayne Dyer say this exact same thing today on the audiobook I was listening to, because then you're getting fed this information that can be very negative about other people's stories. You have to remember that's not your story, right? That's not your story.
I love that.
Your story is very different. And I think it would be so scary for people to, when they're in this situation and then they're hearing all these like, oh, my grandpa died of that. And, I remember someone said that to me about something. And I was like, I don't want to hear that. Can you not say that to me?
Yeah.
Or, it's like that is them and you are individual, and the way that you get through whatever you have is completely separate. And I think that's very important to know as well.
I love that you're sharing that information. I think people need to hear it. When I, diagnose somebody with cancer and we are having that conversation in my clinic, I say, now you get to choose who you share this information with. Because once you share this information, everybody wants to help and everybody's very well-meaning, but everybody's going to give you a piece of information, whether that's what you should do or you shouldn't do, or my aunt's situation or blah, blah, blah. I'm like, it's very well-meaning. It's coming from a beautiful place, but it can be very overwhelming. So ultimately, you get to choose who you even want to share this information with. And know if you do, they're well-meaning, but they're going to give you even more things that are then on your plate to think about.
It's so true. Kelly, what do you think about the state of women's health at the moment? Obviously, there's, thanks to the work you do, Mary Claire Haver, Vonda Wright, there's a gazillion people in that area. I'm just mentioning the few that you came out with on tour. There's so much now that is brought to light, perimenopause, menopause, which is a great thing. And women's health is really, finally, it's gotten its time, and we're getting a lot more research because we, as you mentioned, basically had none. So this is so great. What do you think that people, particularly women, don't know so much about women's health that the spotlight hasn't been placed on that they should know?
The risk of, and this is speaking to the Australians too, because I know when I came to visit Sydney, I read a statistic that the next year, 2026, the number one killer of Australians is dementia. And that just shook me. I was like, you guys, your future is here, right? The future that we know is coming. We're living long, but we're not living well with our brains. And Australia has a very large drinking culture. Like I would say you guys have more of a drinking culture than the US does. The US is really going through a kind of alcohol-free lifestyle trend.
Yeah. Can I just say I was in New York last year and I went out for dinner with 10 middle-aged women and I was the only one having a drink. And I actually don't drink, as I barely drink. And I remember just thinking, no one here's drinking. And to your point, I just wanted to say that no one was having a drink.
Yeah. No, we're having a moment, which is fantastic because, I mean, to me, I'm like, women don't know alcohol is associated with breast cancer. They say 10% of breast cancers are alcohol caused. That's not small. And same with dementia. Like every time you take a drink, you are sacrificing brain cells. So, and you're also, metabolically, the body can't do anything else when it's processing alcohol. So it messes with your liver function. It messes with, fat burning. It messes with glucose metabolism. And so it's like I think the average person doesn't understand the significant risk that is completely optional. Like we're all aging. All of our cells are making mistakes, right? That is the cost of being alive. It's not optional to age. But drinking alcohol and putting a known toxin, and people justify it, and they say it's well, just a little bit, and they hang on to the privilege of putting a toxin in their body. And I actually, when I was in Australia, I got shamed by the waiter for not drinking. We went out to this beautiful dinner after the Sydney Opera House event, and I was like, "Oh, in America, they work for tips in America, so no waiter is shaming an American for not drinking." But I was like, "Oh, that's new." But instead of like being celebrated for like, great, what else do you want? He's like, he was literally like, what's wrong with you? And I was
really?
like, yeah. And I was like, dude. So I think that is like I was hanging out with two doctor friends. I was talking about alcohol and cancer and dementia. And they're like, Kelly, people know that. And I'm like, I don't think they know that.
No, I don't think they know that. I really don't. And as someone that doesn't drink much, I drink less. I mean, I never really drank. No, I didn't grow up with parents that drank. It's never been in my orbit. And the older I get, I have one or two drinks and I will wake up the next day and my mood will be off, right?
Yeah.
And I don't want my mood to be off.
Yeah.
I don't want to feel on edge. And I think that a lot of people, and I say this especially actually to a lot of younger people, like in their 20s and 30s, where they're so anxious. And they're so on edge, and it's really the anxiety thing. I was talking to a beautician of mine the other day, and she said her panic attacks got so bad that she can barely one day leave the house, right? And I said, I'm not going to judge you, but do you take drugs or do you drink a lot of alcohol? And, we kind of moved through that. And I was like, just know that those two things are going to drive your anxiety worse. And what I think a lot of people actually don't correlate that drugs, and when I say drugs, I'm talking about illicit substances, marijuana, cocaine, and things like that. People don't realize that they give you anxiety. I mean, to me, that's the most obvious thing in the world. But a lot of time people will take these drugs and then they're on antidepressants.
Yeah.
I don't get that.
It's crazy to me that anybody who's on an antidepressant would add something that causes depression and anxiety to their life.
Yeah.
They don't know. And it's so normalized. And it's, again, talking about how society informs our thoughts of like, drink when you're happy, drink when you're sad, drink when you're grieving, drink when it's a celebration, and the brain, just the way the brain works, the brain wants its dopamine. Right. And so when people hang on and justify of well, it's just so accepted, or it's just a blah, blah, blah. It's like the brain will hang on to it. It actually might take a little bit of work to separate yourself from something that society has said is okay. I mean, drinking is a massive business. There's a lot of money made by keeping the status quo the way it is. And I was in Australia and somebody's like, yeah, people bring bottles of wine to children's soccer games. And that is, you do not do that in America, right? We drink a lot, but not at children's soccer games. And I was like, whoa, what are you guys doing over here?
Yeah, I think people don't realize the effects that alcohol has long term as well as short term with the anxiety and things like that. I mean, there was, I'm a mindset coach, and I was coaching a client many years ago who said that he was a big executive. He would drink to fall asleep. And he actually didn't realize that the sleep quality is so much worse. Yes, you might fall asleep quite fast, but then you wake up in the middle of the night, you don't hit that REM sleep, you're not dreaming, you get overheated, you're waking up early, you're dehydrated. People don't realize that.
Yeah. Yeah, no, you're absolutely right. And people, the cool thing is wearables, I'm wearing a Whoop and people have the Aura ring, and you can actually see how crappy your sleep is now when you drink. And it's
Yeah.
helping a lot of people wake up to it of like, they like their scores to be good, like they like not being told they had crappy sleep. And they're like, man, I will sacrifice a night of sleep whenever I have a drink. And they can actually see it now because of technology.
Yeah. I wonder, Kelly, what is the lesson that has taken you the longest to learn?
The world will reward you for being more and more of yourself. Like, as much as we're marketed to like keep up with the Joneses and make sure you fit in and blah, 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 blah. It's like the more authentic you are, the more you are, it's very attractive to people to be like, that person's not faking it. You can tell, you get to, and I'm sure you can, with the work that you've done and the skills that you have, like you can tell when people have masks on.
Oh, 100%.
Like, yeah, you know what I'm talking about? Like not a lot of people think about that, but you get to a point where you're like, I can tell when you're wearing a mask. Because you've done enough like internal work to be like when somebody's like real in themselves. And it's like the superpower of finding your core and finding your voice and finding your why and finding like, what do you want? What do you want? What do you want in life? What do you want to do? And I think if some people spent just a little more time being like, I don't care what society wants or society says you should do or your partner says you should do or your doctor says it's like, what do you want? And if you don't know, what an amazing opportunity to try to figure it out.
Yeah.
Right.
Oh,
and
I love
ultimately,
that.
going into, the gurus and Eckhart Tolle and Wayne Dyer is like, if the purpose of life is possibly just to discover how to love yourself more and more and more.
It's so
It's
true.
like, so understated.
And to your point about being yourself, follow what feels good for you. Just because some people tell you you can't, or there is what you feel is like a speed hump or something like that in the way, a detour is not a no. A detour is not a no. It's just a change of course, right? And just keep going, because if you show up as your true self, you're going to get there. If you're a kind, good person and you're serving the world in some way or another, you will get there. Don't let other people tell you that you won't. So it's such important information.
I love the metaphor. I don't know who to give this credit to, but it's like if you're driving to the grocery store and you hit a bit of traffic, you don't stop and go back and not go to the grocery store. Right? You're like, there's traffic right now. I'm going to find a detour or like wait out the traffic light. It's like when on the way to the grocery store, you don't stop when there's traffic. And I love that metaphor for life of like, if it's a roadblock, you just work around it. Keep it like the journey is the whole point. And I think that we forget that, you're like, I'm in traffic. It's the worst. It's like, well, no, it's just traffic. We can work around it. Keep going to the grocery store.
Totally. I mean, I can imagine like you're having your day now, but it would have been so hard for you when you first started.
I thought, yeah, it was interesting. Like when I started, a woman changed my life. I started to learn a lot about female sexual health. I started to realize what a big problem this was. And I love podcasts. And I thought maybe I should start a podcast. And I was waiting for somebody's permission. And I had a person in mind who was the person that was going to come and give me permission to be like, Kelly, you know enough now. You should do this. And I was like waiting for this person. It was a man. I was waiting for this man to come. And I got out of the shower one day and lightning hit. And I was like, the only permission you need is your own. And once you figure that out, then you're like, oh, guess I should start a podcast. And that's the beginning of realizing your permission is the only permission you need.
Yeah. It's so funny. I interviewed Mel Robbins and she was saying that her friend Jay Shetty had a podcast and she's like, oh, Jay's got one. So I can't do one because Jay's got one on something similar. So I just won't do one. And so for years she just did it. And then she's like, you know what? I think it's time. I'll start a podcast. She's got like the biggest podcast in the world. It's
like the biggest podcast in the world.
But it's because Jay Shetty had one. It's so funny what we think.
Brains, man. Like, and that's the thing is like, you got to be able to see those thoughts. And that's like the skill and the practice is like, see those thoughts and be like, Jay Shetty might have a podcast. And also I could have a podcast.
Yeah.
Let's see. And if I have a podcast, and if I do a podcast and nobody listens because they're all listening to Jay Shetty's, then I will know. But that's like the chance of that happening is low.
It's so true. What is something, Kelly, that you wish for yourself?
Oh, I mean, it's the constant slow down and smell the roses. Like this is there, and I'm getting better and better. There's no destination at this point. I truly do believe like I'm being used by the universe to help educate women and doctors worldwide, and it's been an incredible journey. I got to fly and speak on the Sydney Opera House and pet a koala, and that was never part of the bucket list. And it's like the more I accept that I'm on the journey and incredible things are coming, it just realized like it's an incredible ride, and the best privilege is just to be alive.
What's your favorite prayer or saying or mantra?
Ooh. There's no there. Because I think we're all striving. We're all striving like, what's the perfect hormone regimen? What's the best way to have sex? What's the, best way to exercise in midlife? And it's like, there's no, besides death, there's no finish line. We just get to keep like learning and experiencing, and it's okay to fail. That's a big one too. We all think we're going to die when we fail. It's like, well, we won't. Yeah. And maybe it's just the traffic on the way to the grocery store instead of like the tragic failure.
And we feel like it's so hard at the time, which it is. And then like everything in life, hey, it just, this too shall pass. This too shall pass.
And like Steve Jobs, who founded Apple, said like the everything makes sense looking backwards.
But we must live life looking forward.
Yeah, you have to live life looking forward. But, you look back and you're like, had I not met that person, I wouldn't have met my husband, which means I wouldn't have had my kids, which means like, it's just like crazy how it all, and then you realize like I wouldn't have changed any of it because that the life was the whole point.
What's been your greatest mystical experience?
It's the, what do they call it? Synchronicity or something. It's like when you like, I'll think of my brother and he will call me. Right. And they say like the experts, which I am not one, they did not teach us this in med school. They're like, the more you're aware of that and see that happening, the more it tends to happen. And to really like, it's profoundly statistically impossible that you think of somebody and the phone rings then. But it happens, and it's like, I don't know, I can't prove it, like it's very woo-woo, but man, I enjoy the hell out of it when it happens. It totally makes me giggle, like it's a complete trip when it happens. And like I just there has to be something spiritual there.
It's like the frequency is aligned. I have to tell you this crazy synchronistic story that happened on the weekend. So I'm in Noosa and I'm walking, going for a walk. And the person I was walking with for about like 10 minutes, we're talking about the Tour de France because we're both very interested. And when we're talking about the different races that's on at the moment, and really getting into this chat about the tour, you will not believe who walks past us. Cadell Evans, the only Australian to ever win the Tour de France, walks past us in the 10 minutes that we're randomly talking about the Tour de France on this walk in Noosa. Talk about synchronicity. I'm like, I can't believe Cadell Evans, the only Australian ever in all the places that we're walking, to walk past us at the only time that we're talking about the Tour de France. You just can't make this shit up.
I know. No, you can't. And, people will blow it off, and it's fine if they blow it off. Yeah. Like, I don't need the whole world to, like I don't need the whole world to think that this is normal or possible or anything. But I mean, I'm obsessed. Have you heard of the Telepathy Tapes podcast?
No, but so many people have emailed me, fans of this podcast, saying, Sarah, can you please listen to it and get someone on? So I haven't, but you are the
start at episode 1
to mention it to me. Yes,
don't start in the middle.
Okay.
Start at episode 1. You'll love it.
I will. And our final question, Kelly, what is a life of greatness to you?
Becoming more and more yourself. Figuring out who what does Kelly want? Kelly wanted short hair 3 years ago. Like, I didn't know that. Like, turns out this was under the long hair. And it's just like, what does she want? Does she want a hand tattoo? No, not today. No, she doesn't want that today. It's just like, and it's like asking questions. Like, what does she want? What does she... And it's kind of that subtle energy of like being attracted towards what you're supposed to, what does she want? And how does she want to spend her time? And just kind of getting curious about yourself. And, I had read somewhere like you will spend time with yourself proportionately way more than anybody else, more than somebody at work, certainly more than your kids, which is like tragic and sad to me, and more than your partner, right? And it's like you are with you from the beginning until the end. Isn't it wonderful to love that person and to be in a relationship with that person and to be curious about that person and to love that person? And so like, I just think that's a very cool concept.
I love that so much. Kelly Casperson, thank you so much for all the work you do. Thank you for this conversation today. It's gone to so many places that I've loved so much. So thank you so much for your time.
Thanks for having me. Thanks for making this so fun.